Good afternoon to all. Today we are discussing about subcutaneous infusion. We nurses are more familiar with intravenous infusions, and but we heard about but we know about subcutaneous injections. But it is little bit different from IV infusions. And which are the common medications that we are giving subcutaneously? Any idea? What are the common medications that we are giving subcutaneously? Yeah, insulin, heparin. These are the common medications that we are giving as subcutaneous injections. But today we are discussing about subcutaneous infusion. And how many of you are practicing subcutaneous infusions in your settings? How many of you are familiar with this topic? Are you practicing subcutaneous infusions in your settings? Okay, let's see. This is a picture shows the layers of skin, and first one is dermis layer, and next is subcutaneous layer and muscle layer. Next is muscle layer. Today we are discussing about the introduction of fluid into the subcutaneous layer, that is subcutaneous infusion. Subcutaneous infusion is otherwise known as hypodermoclysis. Hypodermoclysis can also be called as interstitial infusion. And what we are doing here is infusion of isotonic fluid into the subcutaneous space for rehydration or for the prevention of dehydration. What do you mean by isotonic fluids? What do you mean by isotonic fluids? Which is the common isotonic fluids that we are using in our setting? Which one is that? Isotonic fluid. You can use chat box for chatting. What do you mean by isotonic fluid? Any idea? Isotonic fluids means IV fluids that have a similar concentration of dissolved particles as blood. Isotonic fluids contain similar concentration of dissolved particles as blood. What is the example for isotonic fluid? Any of you know? One example for isotonic fluid that we are commonly using in a daily basis. 0.9% sodium chloride as a normal saline is the common isotonic solution that we are using in our settings. And here, here we are saying that here we are introducing an isotonic fluid in the subcutaneous space for rehydration or for prevention of dehydration. The main thing is we are not talking about a large volume. Here we are using talking about a small volume of fluid. Here we are introducing a small volume of fluid into the subcutaneous space. And what are the main indications? Is there any indication for starting subcutaneous infusion? What are the main indications? We already discussed one indication. The main indication is it is ideal for preventing dehydration. Mainly, we are treating mild to moderate dehydration through subcutaneous infusion. We are not treating severe dehydration through the subcutaneous infusion. We are only treating mild to moderate dehydration. And if the patient is having severe dysphagia, that is swallowing difficulties there, and if the patient is confused, in that situation also we can choose subcutaneous infusion. And we already said we are talking about a smaller volume. And if the fluid need is less than 3 liters per day, then we can choose subcutaneous infusion for that patient. if the fluid needs is less than 3 liters per day. These are the common indications for subcutaneous infusion. But in palliative care, what are the common indications? What is the importance of subcutaneous infusion in palliative care?
Dehydration.
Okay, we are using this for rehydrate the patient. Then
Sunita ma'am, your voice is breaking. Please send that chat message so that we can see that message.
in dehydration, we are talking about the importance of subcutaneous fluid, subcutaneous infusion in palliative care. Let's see. The common indications in palliative care include, first one is nausea and vomiting. We know most of our patients, palliative care patients, are cancer patients, and they are receiving chemotherapy and radiation. And after that, we know they may experience severe nausea and vomiting. And due to the continuous chemo and all, it is little bit difficult to access a patent IV line. So that situation, if the patient is having dehydration, we can choose subcutaneous infusion site for that patient. Then we know what is the common side effects of opioids. If a patient is having morphine, what is the potential complication or potential side effect?
Constipation.
Yeah, the patient may experience constipation and potentially they may experience nausea and vomiting after taking opioids. In that situation, we know the patient is already on chemotherapy and radiation and now he is having severe vomiting, and we can't able to introduce anything orally, or due to the unavailability
Vasodilation.
of IV line, we can choose subcutaneous infusion for that patient. Then next one is mouth, throat, and esophageal lesions. We know in head and neck, mostly in head and neck cancers, sometimes there is a chance of formation of fungating wound and fistulas on the head and neck region. And in this type of situation, it is little bit difficult to insert a Ryle's tube to that patient. And due to the chemotherapy and all, there is an unavailability of patent IV line also. So how to rehydrate this patient? In this type of situation, we can use subcutaneous infusion. We can choose subcutaneous infusions for that patient. Then next common indication in palliative care is intestinal obstruction. We know in intestinal obstruction, the patient is already constipated. There is nausea and vomiting. So oral intake is difficult, and if we are forcefully giving oral intakes or trying to rehydrate through orally, it may worsen the situation. What is the next choice for rehydration or intake? Patient can't take anything orally. He is already constipated and having nausea and vomiting. Which one we will prefer next? Next one is parenteral nutrition. But we know due to the unavailability of patent IV line, we can choose subcutaneous infusion for that patient also. Then if the patient is unconscious, we can choose subcutaneous infusion. Then intractable symptoms that are well controlled by oral methods. What do you mean by intractable symptoms that are not controlled by oral methods? Any idea? Most of our patients are receiving antiemetics orally. Most of our home care palliative patients are at home and they are having oral antiemetics. And if the patient is developed after chemo and all, there is a chance of development of severe vomiting, acute episode of vomiting. That time the patient can't able to take it orally. And due to the unavailability of IV patent line, they may withhold the drug. and it may worsen the patient condition. That time we can choose subcutaneous infusions for continuous infusions and all. And if the rectal route is inappropriate, we know most of our palliative patients are on opioids, mainly on morphines. And if the patient is in home care, and if the patient develops severe vomiting, they can't able to take the morphine orally. If the patient is in home care setting and this patient contacted you, what will be your advice for this patient? Patient is in home care setting and he is on vomiting. He is having severe pain also. How will you administer morphine for that patient? Patient is in not in hospital setting, he is in home. He is at home. How will you give morphine for that patient?
Oral, ma'am.
Ma'am, patient is already having severe vomiting, so he can't take it orally.
Okay.
Yeah, so they contacted us, and now patient is having severe vomiting and he can't able to take it orally.
Patch, phenytyl patch.
No, ma'am. Patient is at home care settings. Fentanyl patches are more expensive. Patient is only having morphine on his hand, tablet morphine. What is the next route of administration of morphine? We can give same oral morphine dose as rectally. We will instruct the caregiver or patient to make it as a paste form and advise them to give rectally. It is same as oral dose and absorption is same, and we can give it as rectally. But we know the most common side effect of morphine is constipation. Most of our patients are experiencing chronic constipation, and there is a chance of developing spurious diarrhea for that patient. Right? What do you mean by spurious diarrhea? What do you mean by spurious diarrhea?
Excessive, है ना? Excessive, frequently passing stool in a loose stool frequently.
Yeah, the bowel is blocked by
What
heart. Yeah, bowel is blocked with heart impacted vessel, but some fluid managed to seep past the blockage. This is the spurious diarrhea. So in some patient, there is a chance of spurious diarrhea at that time. So that time rectal route is also inappropriate. And we know this patient is receiving chemotherapy for long period and there is no IV patent line. Then we can choose subcutaneous infusion or injections for this patient. That is the rectal route is inappropriate. We can give morphine as rectally, but if the patient is experiencing any diarrhea or spurious diarrhea, we can choose subcutaneous infusion for that patient. Then what are the common subcutaneous injection sites? What are the common subcutaneous injection sites?
On the
Subcutaneous injection sites. What are they?
the upper arm,
muscles में तो
Deltoid.
lower abdomen, ma'am.
Okay, abdomen region. Any other answers?
the lateral aspects of the upper thigh.
Okay. Okay. These are the common subcutaneous injection site. We can give subcutaneous injection on the upper chest area, that is intercostal plane area, then upper arm, outer aspect, then abdomen, outer thigh, upper back and scapular area. These are the common subcutaneous injection sites that we are normally using. And what are the sites that contraindicated for subcutaneous infusion? We are not choosing sites with lymphadematous area. What is happening in lymphedema?
The lymph drainage is blocked and there is
Already the drainage is blocked and the circulation is compromised. So we are not choosing lymphadematous areas for subcutaneous infusion. Then skin sites that have recently irradiated. Then we are not choosing bony prominence for subcutaneous infusion. And if the site is in close proximity to a joint, that we are not preferring. Then skin folds. And if the site is having any inflammation or infection, that site also we are not preferring for subcutaneous infusion. Then if there is patient is having ascites or pitting edema, then there is a tumor or scarring. These are the sites contraindicated for subcutaneous infusion. What are the medications that we are giving subcutaneously in palliative care? Common medications that we are giving subcutaneously in palliative care. Any idea?
morphine.
Yeah, we can give morphine through subcutaneously. Anything else?
Isotonic fluids.
Yeah, we can give isotonic solutions. Then name of medication. Morphine, it's right. Then any other medications that we are commonly giving through subcutaneously?
Insulin, ma'am.
Insulin, ma'am.
Okay, insulin. Any other opioids? Morphine we are giving subcutaneously. Okay, let's see. These are the common medications that we are giving subcutaneously in palliative care. We can give injection morphine sulfate, then injection haloperidol, then injection midazolam we can give, injection metoclopramide, injection hyoscine butyl bromide, and fentanyl. These are some of the common drugs that we are giving subcutaneously in palliative care settings. And which are the medications we are not preferring through subcutaneously is injection chlorpromazine, then injection diazepam, then chlorpromazine. These are the medications that we are not giving some of the medications that we are not giving subcutaneously. You want to add anything in this last one? Contraindicated medications subcutaneously. What are the medications we are not preferring subcutaneous routes?
Ondansetron, ma'am.
Then commonly we are not giving any antibiotics. We are not choosing antibiotic administration through subcutaneously, and we are not giving any oily preparations through subcutaneously.
पूछ लिया.
Keep in mind, ma'am. These are the common medications. We can give morphine, haloperidol, midazolam, metoclopramide, hyoscine butyl bromide, fentanyl, and we are not giving stemetil, diazepam, and chlorpromazine. And next is about the procedure. This is same as intravenous insertion procedure, but there is some difference in the needle of angle of insertion and all. And first we should explain the procedure to the patient. What we are going to do, what is why we are choosing subcutaneous infusion for that patient, like that we should explain to the patient. Then wash hands and assemble all the equipments that we needed and swab the site with an antiseptic solution using a circular motion from central to outerward and leave to dry. And do not touch prepared site again with fingers. It will contaminate the space. And here we are inserting the needle at a 30 to 45 degree angle. And we should secure needle and tubing with the occlusive dressing also. And then we can adjust the drip rate. Next is one video about subcutaneous infusion procedure. Let's see and come back. Any doubts? I think now the procedure is clear for you. And in subcutaneous infusion, the volume and rate is very important. We already said here we are introducing a small volume to treat mild to moderate dehydration. And so the volume and rate is very important. Here we are only administering 1 ml per minute, that is 20 drops per minute in a subcutaneous infusion. And if the patient is having moderate rehydration, we can choose 2 sites at a time. But there is a fluid limitation for the administration. In one site, we can administer maximum of 1.5 liter over 24 hours. At one site, we can administer 1.5 liter over 24 hours. This is the maximum administration rate. And if we are choosing 2 sites, within 24 hours, we can administer up to 3 liter. This is about the volume and rate. And the post-procedure include we should make sure that we are not set drip rate to deliver more than 1 liter in 2 hours. That means we should set the drip rate as 20 drops per minute. And we should document the infusion fluid on the medication chart. Then check patient and infusion after 1 hour to ensure that the infusion site is correct and there are no longer signs of edema and leakage. The principle of action in subcutaneous infusion is diffusion, and this is the movement of molecules from higher concentration to lower concentration, and it will take some time. So we should, before starting the procedure, we should explain the potential complications or side effects that we are expecting from the subcutaneous infusion. If we are setting more than 20 drops per minute, there is a chance of development of edema on that area, and this will lead to leakage from the infusion site. So diffusion is happening, so it will take some time, and we should ensure there is no signs of edema and leakage from the infusion site. And if necessary, the infusion site can be massaged to enhance edema absorption. Before applying subcutaneous site or infusion, we should explain the potential complications that we are expecting. That is, first one is edema and second one is leakage. If there is edema occurred, we should enhance them to do gentle massage on the infusion site. Then what are the advantages? Any idea what are the advantages of subcutaneous infusion? Any advantages?
Excuse me,
Especially-
ma'am. Pure rehydration.
Yeah. We can choose it for mild to moderate dehydration.
Ma'am, in which cases we prefer subcutaneous infusion than IV infusion?
Can you repeat it once more?
In which cases we prefer subcutaneous infusion than the intravenous infusion?
Are you talking about the subcutaneous infusion? What are the indications? Or what kind of patients you choose subcutaneous infusion? Your question is not clear. So that is why I'm asking again.
Ma'am, asking that in which cases we prefer subcutaneous infusion than the intravenous infusion?
Yeah, ma'am.
So that already we discussed. We will come to you that part later after this part. Definitely we will teach you again.
Okay. The main advantages include it is low cost. In our settings, we are usually using scalp vein set or butterfly needles for subcutaneous infusions. And some institutions are using IV cannulas for subcutaneous infusion also. It is very low cost and more comfortable than IV administration. We know in IV administration, we need a patent IV line. But here we don't need a patent IV line. If the subcutaneous sites are intact, we can administer subcutaneous fluid for that patient. Then less likely than IV administration to cause pulmonary edema or fluid overload. In IV administration, there is a chance of more administration of fluids, but we know in subcutaneous infusion, we have a limit. At one site, we can choose maximum of 2 sites for subcutaneous infusion for a patient in a one day. And the total volume of administration is 3 liter over 24 hours. So there is a less chance of development of pulmonary edema and fluid overload. Then simple insertion, less distressing than IV, easier reinsertion at new site. It is very clear we are not touching any IV line or not. So it is less distressing than IV and easy to reinsert and more suitable for home care than IV line with less staff supervision. If we know if a patient is with the IV line, there is a chance of bleeding, clot formation, and thrombophlebitis and all. Here there is less chance of these complications, and we can teach the caregiver how to insert a subcutaneous line. So it is more easy and suitable for home care patients. And we are not touching any IV line, so there is a chance of thrombophlebitis is less, and there is no chance of thrombophlebitis, and has not been shown to cause septicemia or systemic infections is here, and can be start and stop at any time, no danger of clot formation. Because we are not touching any blood vessels, so there is less chance of clot formation in subcutaneous infusion. These are the main advantages. And next is about some of the disadvantages. There is a possible irritation and inflammation at the infusion site. So we should make sure the fluid is isotonic and there is no oily preparations. Otherwise, it will make irritation and inflammation at the infusion site. Then possible leakage of subcutaneous site. We already discussed the principle of action is diffusion. So it will take some time. If we are introducing more than 20 drops per minute, it may cause edema and leakage from that subcutaneous site. Then allergic reaction. It is very rare in subcutaneous infusion, but we are expecting, rarely we are expecting some allergic reactions. And these are the common or potential complications or side effects that we are expecting from subcutaneous infusion. First one is localized edema. We should explain these potential complications to the caregiver and the patient before starting the subcutaneous infusion. First one is localized edema. I already said localized edema is due to the over administration, or if the drip rate is more than 20 drops per minute, there is a chance of development of localized edema. If we are noticing localized edema at that area, we can advise them to give a spontaneous or gentle massage on that area. It will dissolve. Then inflammation and cellulitis. Inflammation and cellulitis is mainly due to the poor aseptic techniques that we are following at the time of needle insertion. So it is associated with poor insertion technique and management of insertion site. So that may lead to inflammation and cellulitis. Then next potential complication include pain and discomfort at insertion site. It is very rare, but if we are introducing fluids more fastly or more than 20 drops per minute, it may cause pain. If the patient is complains of pain, first we should reduce the drip flow rate from less than 20, and we can start it from 10 to 12 per minute. Like that, we can restart. Then puncture of blood vessels during insertion. It is very rare because we are not in subcutaneous infusion. We are inserting the needle into the subcutaneous space, and we are not touching the IV line at all. Then puncture of blood vessel during insertion is very rare. Then hematoma around insertion site. It is very rare, but if some patients with low platelet count and if the patient is receiving anticoagulant therapy, there is a chance of development of hematoma around the insertion site. So we should check the platelet count, and if there is any history of anticoagulant therapy, we should assess. Then infusion device occlusion. It is very rare in subcutaneous infusion. Occlusion is mainly due to the kinking of the external tubing. These are the potential complications that we are expecting from subcutaneous infusion. Before starting the procedure, we should explain each and every complications and side effects to the patient and caregiver, and should explain what will we do when these occur. Then what are the nurse's responsibility in subcutaneous infusion? Any idea? What are the nurse's responsibility? The nurse's responsibility include, we should inspect the site every 4 hourly. The nurse should inspect the site every 4 hourly for any tenderness or hardness at the site. If there is any tenderness or hardness at the site, then presence of hematoma. We should inspect the site for any presence of hematoma. Then leakage at the insertion site. We already said the leakage is mainly due to the increased flow rate. So we should inspect the area for any leakage. Then local tissue irritation. Then inspect for any erythema or redness in the infusion site, and presence of blood in the tubing. We know we are inserting the needle in the subcutaneous space. So there is no chance of bleeding. And if there is bleeding, that means we are inserting the needle into a intravenous line or blood vessel. So we should inspect the site for blood in the tubing. Then we should inspect for displacement of the cannula. If the cannula is displaced, there is a chance of leakage. These are the main common nurses' responsibilities that we are following in subcutaneous infusion.
Thank you, Sister Reshma, for the wonderful presentation. Anybody have any doubts? I know, so you all are familiar with subcutaneous injection, but not familiar with infusions. So if you have any doubts or any clarification needed, please ask.
हेलो मैम
Yes, yes.
मैम रूटीन में इन्फ्यूजन तो नहीं देते सबकोटेनियस आईवी आईवी लाइन से आईवी फ्लूइड्स देते हैं बट रूटीन में नहीं देते ओनली ये कैंसर पेशेंट्स के लिए दिया जाता है
Yeah, so thank you. So here we used to we have the cancer patient and non-cancer patients. We used to use subcutaneous infusion for non-cancer patients also. If they are not able to take oral medications, that patient need medications. Then we will choose subcutaneous route for infusion.
ओके मैम थैंक यू मैम
And it is more suitable in home care settings.
Education slide and so one of you asked before about the common indications in palliative care. We already discussed this. So she will discuss again because these are the common indications in palliative care. You can give subcutaneous fluid and anyone, but these are the common situations which we are choosing subcutaneous route.
The common indication in palliative care, first one is nausea and vomiting. We know most of our palliative patients are receiving chemotherapy and all, and they are on narcotics, opioids. So there is a chance of development of nausea and vomiting. And at that time, they can't able to take tablets orally. And due to the long treatment for cancer and chemotherapy and all, there is no patent IV lines are there. So that time we can choose subcutaneous infusion for that patient. And in mouth, throat, and esophageal lesions, we know in head and neck cancers, most of the patients are having fungating wound or fistulas in head and neck region. So that time it is little bit difficult to insert a Riles tube. So instead of that, next we are choosing is parenteral nutrition. But that time, due to the unavailability of patent IV lines, we can choose a subcutaneous infusion. Then, like that intestinal obstruction, also the patient is also constipated and having nausea and vomiting. At that time, if we are introducing anything through orally, it will worsen the situation. That situation, we can choose subcutaneous infusion for rehydrating that patient. Then, if the patient is unconscious, we can choose. Then, intractable symptoms. Mostly, if the patient is on tablet, but due to severe vomiting and all, they can't take it orally. And that situation, we can shift it into subcutaneous injections or infusion. Then, if the rectal route is inappropriate, then that time also we can choose subcutaneous infusions for medicine administration. These are the common indications in palliative care that we are choosing subcutaneous infusions. Is it clear, ma'am?
Yes, ma'am.
Thank you, Reshma. So actually, most of the we prefer the oral route, but sometimes the oral medications that cannot take it orally because of the some oral lesions or maybe nausea, vomiting. If the patient is having intestinal obstruction, also the patients will start vomiting. So that patient is not able to tolerate that medications, and sometimes intractable symptoms, it means that particular symptoms which is not able to manage with the oral medications. So that time we can choose rectal route, but that time all the rectal route is also take some time than subcutaneous. So we usually give intravenous, choose intravenous, but in this situation, if you don't, if you try to get an IV line also, you will not get it. If you try to get an intravenous route, you need to give a multiple pricks. That can be avoided. If you choose subcutaneous route, that can be avoided. So, we can prevent it, no? Multiple pricks we can prevent. So, any question, any other questions? Yeah, so we can given in home care settings also. One question is there. Mainly, it is preferable in home care settings, right? No, in our settings, 95% of patients are getting subcutaneous fluid. When you come to Pallium India, you can see we have an inpatient unit here. When you come to Pallium India, you can see most of our patients is on subcutaneous infusion. The thing is, if you because yes, Pushpa ma'am, any questions?
40%.
So the one important thing you have to keep it in mind is when they come to the patients come to your settings, they all know the intravenous route only. So when they go to the hospital, they usually see in the intravenous route. If you choose the subcutaneous route, you have to tell them why you are choosing subcutaneous route, and you have to make them understand that because there is slight edema is normal. Edema will be there, that is normal, that will absorb gradually. So that edema will subside gradually because here that diffusion technique, no? when you introduce some fluid into the subcutaneous tissue, that needs to the lower concentration to the higher concentration. So it will take time. And at the same time, this fluid is going to the subcutaneous space. So that slight edema will be there, but you have to tell them that that edema is normal. So otherwise, they will come to you all of a sudden and says like, oh, the edema is there. So usually after intravenous line, we usually tell them, if there is any edema formation, please tell us as soon as possible. So because we need to change the needle site. But here is the edema is normal, so that we need to tell them. Any other questions?
And in end of life, the subcutaneous infusion has a major role in end of life care. We know most of our patients are not willing to shift to the hospital at the end of lifetime. At that time, we can teach the caregiver or family members how to insert a subcutaneous line, and we can start subcutaneous infusion at the home care setting. So it is very important in end of life. Most of our patients will restless and all. That time we can give a morphine, haloperidol, midazolam, anything through the subcutaneous. The only one thing is we should teach the caregiver how to insert the subcutaneous site and how to give the medications through subcutaneous lines. So it has a major role in end of life care. So that's why it is very important for that patients in home care settings.
Yeah, that's very important because that few of our patients is last wishes to die in their home, their home. So they used to ask us, "Can I go my home?" So usually the relatives will be in anxious. So oh, what shall we do? Is there any problem developing? So in the end of life care, definitely they have seen some kind of symptoms, so they will be little anxious about that, and they will not accept that loved one wishes. So what we do is we used to give a proper instructions and make them understand that this is very, very, very important, and we will put a subcutaneous line and teach them lot. Or we used to do, our nurses will used to do lot injections into the syringe and teach them how to push injections through this scalp vein site. So that all thing is we teach them, and then they will get a confidence level and go back to their home. Maybe I know a few patients after 1 hour or after maybe half day they were in the home, and then they died. So these kind of situations we faced a lot. So if these kind of situation there, you have to teach the caregivers and get a confidence level and give the injection to them, and they can able to give they can able to push at least 1 ml, 2 ml. So and in between you can tell them call us if you need any help. You can make a video call and instruct them how to give. So these kind of education is needed, especially in end of life care. But one thing we have to keep it in mind is our aim is to reduce the symptoms. No, most of the medications which we are using in palliative care can be given through subcutaneously. So that is very, very important. So few medications we cannot, but most of them can be given. So you can choose subcutaneous route and give a medications through subcutaneous route, and you will get a good symptom control. So that is our aim, and also we can avoid multiple pricks also. So can multivitamin injections be given through this? We don't have any experience. So we used to give injection morphine, fentanyl, the haloperidol, methadone, midazolam. So these all dexamethasone, these all medications we used to use for symptom management in palliative care. So these all medications can be given, buscopan. So these all things you can give it. Any other questions? No. So if you don't have any questions, we can wind up today's session. This is very important part in palliative care, because you should know after the palliative care course, you should know what is subcutaneous infusion, what are the medications which we can given to subcutaneous, and what are the routes, and what are the common indications and all. So, and a few side effects is also there. If you given clear that you can use an aseptic technique, you can follow the aseptic technique. That will not affect the patient much. So always you have to keep it in mind. Use do a procedure in an aseptic technique, and some contraindications is also there. But than contraindications are there, but more advantages, the indications. So you have to keep it in mind, and always, if there is a chance there, you just introduce this subcutaneous infusion into the patients, and see what is the difference is happening there. So these all, and also 1 ml per minute you can give. So 1 ml is 20 drops. So you can give 20 drops per minute through subcutaneous route. The only thing is slight edema is there, but that will subside gradually. Okay. Thank you.
Thank you, Reshma sister, for a wonderful session. Thank you, Shiva ma'am, for facilitating the session. Thank you, everyone, for joining. Thank you. Let's see in the next. Bye.